I am Dr. Santosh Prabhu, the Chief Neurosurgeon at WINS Hospital, Kolhapur. WINS Hospital is an institute which specializes only in brain and spine in Kolhapur. I am going to talk to you about brain tumors today. Brain tumor is a very common problem in the society, and I shall be giving you a brief information on what is a brain tumor, how to diagnose it, and what is its treatment. Normally, our body is replacing the cells that are getting lost. But if this process of multiplying of cells, which normally occurs in the body only after the other cells have died, goes berserk, then a tumor is formed, and if it forms in the brain, it is called as a brain tumor. Now, what are the factors which cause brain tumor, and how do these tumors develop? Nobody knows for sure, but if a family member, your blood relative, has had a brain tumor, there is a greater likelihood of your developing a brain tumor. Similarly, it is said that if you are living in a very close proximity of cell phone towers, then there is a chance that you may develop a brain tumor. So, nobody for sure knows what causes a brain tumor, but I can tell you in brief what are the types of brain tumors. There are broadly two types of brain tumors. One is a primary brain tumor, or the one which arises in the brain itself. This can arise from various normal cells which are present in the brain. For example, if it arises from the neurons or the nerve cells, then it is called as a neurinoma. But more commonly, brain tumors arise from a connective tissue cell in the brain called as the glial cell, and the tumor is then called as a glioma, or if it arises from astrocytes, it is called as an astrocytoma. The tumor in the brain can also arise from its coverings which cover the brain, and that is called as meninges of the brain. If it arises from the coverings, it is called as a meningioma. In addition to this, if it arises from a nerve exiting from the brain, for example, the nerve coming to the ear and coming to the face for movement of the face, it is called as an acoustic nerve tumor. Similarly, a neurinoma or a nerve tumor can arise from any of the nerves which exit the brain, which are called as the cranial nerves. Then we come to the secondary brain tumors. These are secondary, meaning the primary tumor is located somewhere else in the body. For example, it could be in the lungs, it could be in the kidneys, it could be in the uterus, it could be in the ovaries, or it could be in your thyroid gland. And then the cells from this tumor spread through the bloodstream and reach the brain and form a tumor there. These are called as secondary brain tumors, or they are also called as metastases. And very often these metastases are malignant in nature, that means they are cancerous in nature. Tumors can also arise in children. There are some specific types of tumors which arise in children, and the commonest amongst them is a tumor called as a medulloblastoma, which arises from the cerebellum or the small brain which is at the back of the head, or it can arise in the vicinity of the nerves of the eyes, and that is called as a craniopharyngioma. So nobody is exempt. Even a newborn baby can have a tumor which can be called as a neuroectodermal tumor. But these tumors, without exception, can occur in any age group. So one should be aware as to how to diagnose these tumors. So these are the pediatric or tumors arising in the children's age group, but in adults tumors can arise from the pituitary gland also, and they are called as pituitary gland tumors. Very rarely the tuberculous process in the brain, a TB of the brain, can also produce a tumor-like growth inside the brain, and it is then called as a tuberculoma, which is fairly common in our country. Tuberculoma incidentally is the only tumor or only growth in the brain which can be treated with medicines and it can be dissolved away. All other tumors about which I talked earlier need a surgical treatment for their removal and cure. Now, very importantly, how will you know that the symptoms that you have could be caused by a brain tumor? So the commonest symptom is headaches, which need not be very severe, mild headaches, but which are just not going away with routine treatment, could be a symptom of a brain tumor. Especially if it is associated with vomiting. Now, if you have headaches on waking up in the morning and you vomit, this particular combination is highly likely to be caused by a brain tumor. So, the brain's tumor symptoms are divided into two categories. One is a general symptom, which is headache, vomiting. You could have loss of vision or reduction in the vision of one eye or both eyes. You could have double vision or diplopia. All these could indicate a tumor in the brain. Or you could have a fit or a seizure or an epilepsy attack occurring for the first time in your adult life. If an adult gets a seizure for the first time, there is a 40% chance that he may be harboring a brain tumor in his case. So immediately you must seek consultation from an expert. Then there are some symptoms which are typical because of the location at which the tumor occurs. For example, if the tumor occurs in that area of the brain called the motor strip, where the control of the hand and legs are there, this tumor, if it is on the right side, it will control the movement of the left side. So you will have a weakness of the left hand or the left leg. If the tumor is in the speech area of the brain, which is on the left side, you may have a difficulty in speaking or you may have a slurred speech. If you have a lesion which is in the memory area of the brain, the patient may present with loss of memory. Sometimes even a change of personality or behavioral changes could be a manifestation of a brain tumor. And finally, if an adult starts soiling his clothes, he passes urine in his clothes, then almost certainly something has happened inside his brain and he has a high chance of developing or having developed a brain tumor. So once from your symptoms you yourself suspect that you may have a brain tumor, the next thing is to go and visit a neurosurgeon and seek his consult. So a neurosurgical consult will, from an expert neurosurgeon, will with almost high certainty be able to tell you whether you have a brain tumor or not. So what would a neurological surgeon do? He would examine you, he would do a neurological examination on you, he would examine your fundus, he may do a detailed examination and conclude that there is a high possibility of your having a brain tumor, and then what he would do is ask you to undergo an MRI scan of the brain. The MRI scan of the brain is a very accurate test to diagnose brain tumors, and it will certainly show your tumor, it will show the size of the tumor, it will also tell with a fair amount of certainty what is the nature of this tumor, whether it is benign or it is malignant. Once your diagnosis is made, then a definitive treatment needs to be done. So there is no need to despair. There is very good therapy available for brain tumors now, and a center like ours, WINS in Kolhapur, has all the modern gadgetry required to safely remove brain tumors. So surgery is the first and most important modality which is used to remove brain tumors. The purpose of surgery is dual. First is to remove the tumor, and second is to send pieces of that tumor for biopsy, so you know for sure what is the nature of the tumor. If, as statistically you would have a 50% chance your tumor is benign, then this means cure for you, especially if the surgeon has completely removed the tumor in surgery, which any good surgeon would check on a post-operative MRI scan. If by a stroke of ill luck your tumor turns out malignant, then there are many grades of this tumor available to be done. Grade 1 is a very mildly malignant tumor, grade 2 is little more than that, and grade 3 and 4 are quite nasty brain tumors which are malignant and may certainly require adjuvant therapy to control them and to prolong the life. So after surgery, you may need to undergo some adjuvant therapy. But before that, I must tell you about the latest technology that is available at centers like WINS. The first and the very important technology that a neurosurgeon uses to safely remove tumors from the brain is called as neuronavigation, or which is also called as a computer assisted neurosurgery. In this, the neurosurgeon uses a navigation system which is similar to the GPS that is used for flying the modern aircrafts. You could call this a GPS for the brain, and this GPS for the brain allows the surgeon to safely remove your tumor and shows him during surgery where the vital structures surrounding the tumor are lying. So it is possible to inflict minimum damage on the surrounding brain and their important structures. The other technology that we are using is called as intraoperative neurophysiology monitoring, or IONM. The navigation system allows the surgeon to real-time monitor or move around in the patient's anatomy. The second technology, the IONM, allows the neurosurgeon to monitor the functioning of the brain and the cranial nerves during surgery. Very specialized anesthesia is required for this. What it does is, for example, I told you, you need to remove a tumor from the motor area, that is the area controlling the movement of the hand and legs. It is possible to perform what is called as motor evoked potentials, where the surgeon is during surgery monitoring the motor currents passing from the brain to your hand and ensuring that this entire circuit is not damaged during surgery. Similarly, it is possible to monitor the function of the eyes by monitoring the optic nerves during surgery. So various cranial nerves in the brain, for example the facial nerve, which is responsible for the movement of the face, can be stimulated during surgery and damage which may have possibly occurred to that nerve be prevented or mitigated. So this technology is very, very important. Finally, there is a device called as a CUSA, or Cavitron ultrasonic aspirator, which is used to melt away tumors from the brain and remove them without causing damage to the surrounding structures. So a combination of navigation, intraoperative neurophysiology monitoring, CUSA, and of course a highly skilled and experienced surgeon If you have this winning combination, then chances are that your brain tumor will come out without causing any damage to you. So you need to select your center carefully, ensuring that all these technologies are available there. As I said, if your tumor is benign, then this is cure for you. If the surgeon has removed it completely, that's the end of your problem. But if your tumor turns out malignant, then you will be needing adjuvant therapy like radiation therapy, which these days is done in a computerized manner on a machine called as a LINAC. And this image guided radiation therapy is what is these days done for malignant tumors. Also, it is sometimes coupled with usage of chemotherapy. Chemotherapy, fortunately for most brain tumors, consists of only taking oral capsules. There are no injections or anything to be taken, with very minimum side effects, and it is usually a 5-month or 6-month course in which every month you take these capsules for 5 days and then 25 days you do nothing. So all these modalities have definitely improved the cure rate as well as the survival rate in all patients with brain tumors. So my dear friends, there is no need to get upset, or there is no need or there is no need to despair that you have been diagnosed to have a brain tumor. A competent and senior neurosurgeon with all the modern gadgets at his disposal can give you a cure in most cases and a very good control and a very good quality of life after surgery. One last thing that I want you to know is it is also important to have a high quality neuro-rehabilitation backup for you after your surgery in case you have neurological deficits prior to surgery, or unfortunately you develop some during surgery. Then the computerized neurorehabilitation therapy, which is available at centers like WINS, will allow you to recover from this temporary setback and get back on your feet at the earliest. So my dear friends, I wish you all the best, and I have told you in this small video as to how a tumor can be diagnosed, why it occurs, how the symptoms occur, and what is its modern treatment. Thank you very much.